All right, so we have maybe 24 participants, which I think includes myself and Eric. So I'm gonna get things started. I'll give you a brief introduction and we will try to get this accomplished within about 30 minutes or so. Let me go back into Zoom. If you are having any issues with sound or whatever, you can always message me, either my phone for the county, which is 512-395-4214, or you can message me within Zoom and we'll try to help you out. So I want to thank all of you for joining us today and taking part in this call. I am Kim Hilsenbeck, the Communications Manager here for Hays County. I'm going to turn things over to Eric Schneider in just a second. He's with our Hays County Local Health Department, but we'll give him a chance to address everyone. And then I will open up mics and we'll have participants ask follow-up questions. Because of our very limited time, we are respectfully requesting one question per news outlet. We think with the number of questions that we've already received and I've given to Eric and that what we do today, I think we'll be able to address pretty much everything people are looking for. But we do have to disconnect at 2:30 because Eric has to prep that daily report that you all sit around waiting so patiently for later in the afternoon. So once again, we'll let Eric speak. We'll keep everybody muted. And then at the end, when he opens it up to questions, I will call on each news outlet, unmute you, let you ask your question, and then we'll remute you and let everybody hear the answer. Okay? So without further ado, I'm going to turn it over to Eric. So Eric, take it away.
Good afternoon, everyone. My name is Eric Schneider, and I'm an epidemiologist for the Hays County Health Department. We appreciate you taking the time today to join us on this call as we address the questions that we've received from the media throughout the Central Texas area. I want to first say that we are still in a global pandemic. We experienced a lull back in May where some days we only had a handful of cases, but COVID-19 is spreading rapidly throughout the region. Here in Hays County, our cases, our daily cases have been steadily climbing since the middle of May. We are seeing that second wave that everyone has been talking about. Our daily totals just since Friday, June 12th, were 99 on Friday, 142 on Saturday, 54 on Sunday, 69 new cases on Monday, and yesterday's new high of 155 cases. We report those numbers 7 days a week, either with a full report or at minimum, the new cases received. In terms of hospitalizations, we currently have 15 people hospitalized that are Hays County residents. Most of our residents that are hospitalized are between the ages of 45 and 75 and are pretty equally split between male and female. Our team here at the local health department has been working diligently, often 7 days a week, to keep us with the increased caseload. Expected. We also know many local businesses are impacted because a chunk of their employees are in that age range.
I think we just all lost you for a second there. Can you back up like 2 sentences?
Not a problem. I know my phone did ring there. Sorry. I apologize, everyone. I will go back to, since the June 10th report, 58% of new cases reported to us are San Marcos residents in the 20 to 29-year-old age range. We anticipated an uptick as businesses, bars, restaurants, and local hangouts reopen, but that number is growing faster than expected. We also know many local businesses are impacted because a chunk of their employees are in that age range. When they have employees who test positive, the CDC recommends they close down overnight to do a deep clean and sanitize, and not allow those employees who have tested positive back until they have been cleared. This is an important point that I want to emphasize. The Hays County Local Health Department does not have the authority to shut down a business, nor will release the name of every business where someone tests positive. Using the form that the CDC provides while we're doing an investigation, medical providers who conduct COVID tests are not required to ask where a patient works, merely their occupation. Many business owners, once they found out an employee has COVID-19, reached out asking us what they should do. And we are grateful that these business owners who have been voluntarily shutting down for longer periods of time, doing the cleanings and informing the public. They are taking the right steps to ensure proper workplace procedures to help prevent the spread of COVID-19. Some media have asked if we know if people in this age group can identify any large gatherings where their people might have been over the past several weeks. We've seen 2 events or locations where this appears to be the case. The recent protests about racial injustice and floating the rivers around San Marcos and New Braunfels are the main 2 answers we received. Memorial Day weekend saw a large number of young people at mass gatherings. We have been in constant contact with Texas State University officials since this outbreak began. And recently, I have moved to have 2 calls per week with their health director. We want to see the university continue to spread the message to students to protect themselves and their families, friends, and coworkers. At this point, most of our residents should assume that they take the risk of coming into contact with someone who has COVID-19 as soon as they leave their homes. In terms of shutting businesses down, again, the county isn't able to make any orders that are more restrictive than what the state does. And now let's talk about testing. There are several locations around Hays County where people can go for testing. The county partners with Live Oak Health Partners for the indigent and the uninsured. We've set up now a total of 7 free testing sites through the Texas Division of Emergency Management, or TDM, 2 back in May and 5 this week. Sunday's event allowed more than 700 people to get tested here in San Marcos. The people who are not showing symptoms can get tested there as well. You need to contact your local health department and we can make sure you get tested. Our health department is not equipped to do the testing, which is why we partnered with Live Oak and why we share the names of the providers that offer testing on our website and why we coordinated with TDM. As the leading health official in Hays County, I cannot strongly enough reiterate the urge that all of our residents to do the following 3 things to help slow down the spread of COVID-19. Please wear a mask when you go out into public. This includes any businesses, running errands, things along that nature. Physically distance yourself from others, Please physically distance yourself from others who are not household contacts, and wash your hands frequently with soap and warm water. Why do we want you to do these things? It is to protect our entire community, but most of all for those who are at risk of complications from COVID-19 if they catch it. We do these things to protect the most vulnerable, to help those who aren't able to help themselves. It might be that you get COVID-19 and quickly recover, but a parent, an aunt or grandparent or sibling, or perhaps a coworker who is immunocompromised or has underlying health conditions may not be able to recover as well. And it's easy to wear a mask and stay apart and wash your hands. We know most people want to do the right thing, and that is our message today. Let's work together to do the right thing. Let's protect our families, our friends, and the entire Hays County community. Now, before I take questions, I want to remind everyone that much of the data and that we deal with is confidential and protected by HIPAA. So while you might want to know more details, we may not be allowed to answer all your questions. I will take your questions now, and I will hand it back over to Kim.
Thank you, Eric. I'm going to begin, this is very random, but I'm going to begin with the San Marcos Daily Record. And you'll have to wait until I find you on the list. I'm sorry, folks. Just give me a second here. Nick? Nick, can you hear me?
I can.
Okay, go ahead.
Eric, I have a question in regards to how the county reports cases to the state. There was some confusion, I believe, that was created from a press conference that the governor had yesterday, in saying that there were 265 cases reported yesterday and 0 the day before. I was just curious how the county reports information to the state in regards to new cases.
So we report our cases 7 days a week. We have since the beginning of March. Where the governor got that data, you'll probably have to check with him or his staff. But we reported 148 cases, I believe it was, on Saturday, and 52 cases on Sunday. We report to the Region 7 in Temple, and then from there, they report it up to the State Health Department. But our dashboard is updated every single day to report our numbers.
Hey, just to clarify, it was 99 on Friday, I believe 142 on Saturday, 54 Sunday, 69 Monday, and Tuesday was 155.
Thank you.
All right. Next up, we're going to go to the, let me see, I kind of jotted a couple names down here. San Marcos Corridor News. But first I have to find y'all. All right, here we go. Tara, are you there?
Yes, I'm here.
All right, go ahead.
My question was, what is the ratio of positive to negative right now? Do you know?
So far, I've received 5,081 negative results as of 2:15 today. And positives, we are at 1,093. So a little bit of a 1 to 5 positive to negative ratio at the moment.
Okay.
That's what's reported to me.
Got it.
All right. Thank you, Tara. Let's see. I'm going to mute you. And let's go to the Haze Free Press. I've got Anita here. Anita, are you asking the question?
Can you hear me?
There you are. Hello.
My question concerns interpretation of the HIPAA laws. Why are some counties, or why have some counties and some entities been releasing more information than Hays County has released? And what happens to you if you violate these federal guidelines?
Thanks, Anita.
So we're dealing with the resources that we have and the staff that we have here. We weren't releasing a lot of the early information as far as demographics with race and ethnicity because we didn't have a lot of cases. We didn't have a large pool to go from. Now that our numbers are increasing, we have a better estimate of how our statistics line up with the actual county statistics with as terms of race and ethnicity. As far as punishment goes, I'm not in charge of our HIPAA program. I'm just kind of informed of what I can and cannot release. And I'm sure it's fines or something along those lines. That can easily probably be Googled to find that answer.
Okay, I am moving on. We've got Tahera from KXAN. You there, Tahera?
Yes, I'm here. Can you hear me?
Yes, ma'am.
Okay, awesome. So I wanted to touch based on the fact that you mentioned that, Eric, that we have gotten a look at how these cases are affecting businesses and restaurants in so much as that a large number of the cases you have are that demographic that works in restaurants. But what kind of contact tracing is being done right now? And are you hoping to get a better picture of where a lot of these cases exactly are coming from? Is that in the process right now?
Absolutely. We've been doing contact tracing since the very first case that was ever reported to us back in early March. Every investigation, we reach out and we talk to the person who tested positive, talk to them about their household contacts, their place of employment, where they've visited in the last 14 days. And so contact tracing, while it's a big buzzword right now with the media, is not something new. It's something that I've been doing as an epidemiologist for 5 years. And so we do reach out to them and find out where they've been, who they've been in contact with. And then if there is potential high-risk exposures, then we continue on like a ripple effect and start investigating and making phone calls to other people. Now, this is part of an investigation, and the person, if they do not want to share that information with us as far as who they've been around, where they've been, or even their place of employment, they're not required to. And so as we go through our numbers, a lot of our data doesn't actually sync up because many people don't tell us their ethnicity, don't tell us their race, don't tell us where they live sometimes. Forgive me. I have pop-ups coming in. So we just try to understand and try to get as much information as we can, as much as the patient is willing to share with us.
All right, I'm going to go on to Spectrum News. We've got Stacy.
Hi, Eric. I'm not sure if you're going to be able to answer this, but why doesn't Hays County have a public collection site, a permanent drive-through for patients that are wanting to get tested? They may not have symptoms. Why is it still that they have to go through their doctor's office and everything like that? Considering, the bulk of cases are now 20 to 29-year-olds who maybe still have an issue with calling their doctors and getting a test. So why don't we make it easy for them to just drive up and get a test? I know we've got the National Guard, but outside of that, what would it take to have the county actually set up a permanent drive-through for those patients?
That seems like a great question for elected officials, but I will take a stab at it here. We want people to get tested. We really have not had a shortage of places for people to get tested. Maybe at the very beginning of this outbreak, we might have had some issues, but ever since things have begun to ramp up, if somebody needs a test, they're not getting turned away. We have 2 locations here in San Marcos. We have the 4 locations that we're working on this week with Tatum. Technically, it was 5. There's testing location sites that are available in Kyle, Buda, Dripping Springs, and in Wimberley. And so we haven't had a lack of testing or testing locations. As far as putting together a drive-through, we are a small health department with very minimal resources, so we're trying to do the best we can with what we have.
Okay, let's see. I really probably should have my cheater glasses on because it's hard for me to see. Patrick Perez. Are you there, Patrick?
I can hear you, sorry.
Remind us which organization you're with.
With KVUE.
KVUE, okay, go ahead.
Hi, so my first question isn't a question, it's more of a clarification. I just couldn't hear too well. Eric, can you just one more time say what you did about you said something about the 2 events where this appears to be the case, where about recent protests and floating on the rivers in New Braunfels. Were you saying that in the sense of like you've seen some of the cases come out of these locations, of these events?
So as we're doing our investigations with people who have tested positive, those are 2 of the main things that we have heard as their response of places that.
Eric, you went frozen again.
Okay. Am I back?
Yeah.
Okay. That's 2 of the main things that we are seeing is that they visited a protest or that they floated the river since Memorial Day. Which was just over 14 days ago, which is about the time frame where we would start to see people who were possibly exposed would be showing signs and symptoms and testing positive right now.
Okay, gotcha. And my actual question, sorry, Kim. I read in the press release that you guys sent out yesterday that the testing that's taking place at these state agencies, or at least specifically the one that happened on June 14th, those results are not being released to the county. Did I read that incorrectly?
Yes, that is incorrect. So Tatum has their own lab where all these specimens are processed, and they will be the ones who will be reaching out and contacting the patients. They will be releasing all of the results to us. Typically, we find out a little bit quicker when they get the positives. They'll let us know and notify us directly so we can reach out and start our investigations and tracing with the positive patients. And then eventually, after they've notified all the people that tested negative, we'll receive a long spreadsheet basically with everybody's names so that we'll be able to add it to our numbers of people who have tested negative.
Okay, and this is just a clarification. So, like, let's say, for example, this testing site that took place on Sunday. How soon would the county's dashboard have the numbers updated of the people who tested positive from that?
As soon as I have them in my hand.
Okay.
Okay, so thank you, Patrick. We have Andrea Hankins.
Hi, this is Andrea. Can you hear me?
We can. Go ahead.
Well, I'm just with the university, so I don't have a question. We were just following along.
Oh, okay.
Hi, Andrea.
Well, thanks for being here. Let's see. I got to go down the thing here. Daniel Weeks.
Hi, can you hear me?
We sure can. Go ahead.
Hi. Okay, so the testing that occurred on Sunday and the testing that's going throughout this week is reported to get results back in about 10 to 25 days. I was wondering what needs to be done in order to speed up that process and get the results back to people sooner.
I have no control over that. TDM has their own lab that they use. I have heard from people who visited Sunday's event that they're actually already posting on Facebook that they had tested negative. So it could be faster. It could be the time frame that they gave. I really have no control over that. I just receive the results whenever TDM is finished processing them.
Okay, thank you.
All right. Thanks, Daniel. Let's see, who else do we have here? Sorry, guys. My thumbs and fingers aren't all working together. Let's see. Travis Cantwell. Travis, are you there? Travis? Travis Cantwell. Okay. Let's see. Who else do we have here? Austin American statesman, Mark Wilson. You there, Mark?
Yeah, I'm here, thanks. Just in the past couple hours, we've gotten word from Governor Abbott that he would let rules stand in Bexar County and likely ones to follow in Travis County that would require masks in businesses. Do you think that that's something that Hays County would be interested in pursuing, or are there any plans to add those regulations moving forward?
Hey, Mark, I'm gonna interject here. If it's something that's about the health department and something that's related to something that Eric has direct knowledge and control over, that will be for this conversation. But the question you just asked may be something that has to go to our commissioners. I don't know that it's something that we could answer in this forum.
Okay, well, that's all I had. If there's any kind of thoughts, I'd appreciate it. But if not, that's fine too.
Okay. Hey, Mark, will you do me a favor and email me, and I'll make sure that we get that passed up the flagpole.
Okay, we'll do.
All right. Okay. Let's see. That was Mark. We got the Hays Free Press. We got KXAN. Who else do we have here? There's a Tristan. I don't know, Tristan, which agency you're with.
I'm with CBS Austin.
Oh, hey, how are you?
Hi, good. How are you?
Good. Did you have a question?
I did. Of the places where you mentioned there's been some outbreaks, do we know about how many people from each of those events that have tested positive?
No, I don't have the exact numbers here in front of me. It's like I said, those are the two of the three most popular answers that we hear is that they attended a protest, they went floating, or they went and visited, late night bars that were crowded, either here, Austin, or San Antonio. So those are just the three main ones that we are hearing in this age range of our new cases that we are getting.
All right. Thank you. I see a question here on the side. Can we talk about any clusters in the county and where and how we can stop those?
So, like as I said, during our investigations, which started back in early March, we have been figuring out where people have been doing contact tracing from the beginning. And so if we identify clusters, we do talk about them with the people who have tested positive just to confirm that they have been in contact with each other. As far as releasing that information, we don't release patients' names, addresses, occupations, so we're not going to release that 30 people right there came in contact at a certain location. We will reach out to people who were possibly affected because they might have been exposed, but that's not information that we're going to release to the media.
Okay. All right, I'm going to ask y'all a favor. If you're a participant and if your news outlet has not yet had a chance to ask a question, please shoot a little note. I think I've gotten everybody, but I certainly don't want to miss anyone's question. Oh, KUT. KUT, Ashley Lopez. Ashley, thank you for speaking up. Hang on one sec. Let me unmute you. Are you there?
Yeah, can you hear me?
Yes, I'm so sorry.
It's okay. Someone else was
it's condensed into this little thing where I have to scroll, so I apologize.
Yeah, and we had to switch out reporters anyway, so I understand.
Okay.
I have a question, like, as an epidemiologist, like, how would you suggest, just broadly speaking, like, floating the river could become safer? I mean, it is outdoors, and the summer's only going to get hotter, and I think it's going to be hard to, like, in general, control people floating the river. I'm just wondering, from your perspective, like as a health, like being in a health department, like, what would you suggest, knowing what we know now, should be done? Thanks.
There are a couple businesses that are around here that I know are requiring you to make appointments, only allowing so many people to be onto the river at a time, limiting the size of groups that are getting together. Those are smart things. Trying to stagger and spread people out would be a great benefit in order to keep it from spreading. Yes, it is outdoors, and yes, it is safe. But the last weekend, I personally drove over the Guadalupe and the Comau rivers, and I could have probably walked across the river just stepping on tubes. It's crowded, it is packed, and if one person has it, there's a good chance that 20 other people are going to get it. So that would kind of be my suggestion: is follow the businesses that are doing the right things, of minimizing the number of people that are allowed onto the river.
Okay, and we have ProPublica is next.
Hi, thank you. Maybe I should ask this question to Andrea, but as far as I know, is Texas State still scheduled to resume on in-person classes in the next couple of weeks? And if that's the case, I'm curious if, Eric, your office has asked the governor's office or is working with Texas State about whether that is the right thing to do, since this age group seems to be particularly sort of high in the numbers.
I think that would be a question for Texas State, not the health department necessarily.
Well, I would like to know, though, if the health department has reached out to Texas State and or the governor's office about that.
So I have been in touch with the health authority for Texas State. We have been talking twice a week for quite a while here now. At the moment, I know they're still talking and discussing what their plans would be. But I have worked with Texas State and their emergency preparedness coordinator, so that way we could develop plans of, should they decide to hold face-to-face classes, what would they do if they start to have cases? How would they react? Would they continue with classes? Would they start shutting down campuses? All of the different scenarios that could possibly play out. So I have been in contact with with Texas State University, and so we are working on their plans as they make their decision of whether or not to hold face-to-face classes for summer 2 sessions.
Thank you very much. We have a question from the group. This is the follow-up from ProPublica. She's asking if Hays County has asked them to consider not holding face-to-face classes at Texas State.
So I have presented them with the facts, with the data that we have of the age range of new positive cases, the fact that we are seeing a skyrocketing increase in the 20 to 29-year-olds that live in the San Marcos area. So I presented them with those facts. They're weighing out their options, and so it is up to them. It is their choice. I can't shut down a business. I obviously cannot shut down a university.
Thanks, Eric. Tahera from KXAN is following up. She wants to know if we can talk about clusters by industry. Now, I know we've been asked this before and we didn't release the information. Are there certain industries or types of businesses where we're seeing more cases? And again, I know we hadn't released this in the past, and We were very concerned about putting out information about certain industries and businesses that wouldn't negatively affect them, whether by, you know, I don't know what you call it, the economy or reputation. A lot of businesses that have cases of COVID in the Hays County area anyway have voluntarily told people that they have it and they've shut down. But that would be a question for you, Eric. If, you know, can we talk about types of industries?
Sure. Like I said, when we're doing the investigation, we do find out where the person works. But on the form, it specifically generalizes the industry. And so I have a list that we've kind of compiled with our data, and the top industries that we are seeing cases where people have tested positive are healthcare workers, construction workers, and then food service. Those are kind of the top three that we do see the majority of cases. There's retail cases, we've seen quite a few where there have been a few people that work in the same establishment that have tested positive, but there's usually small, confined little clusters to one place. But as far as if you're looking for the total numbers that we've had, their occupation, their industry, we're looking mainly at healthcare workers, construction, and food service.
We're actually a little past our time. I really need to let Eric go so we can get that report done. I want to thank each and every one of you. I know you've reached out and you've had lots of questions. We work to try to make sure you have the answers that we are allowed to give. You know, legally, we do have some challenges with HIPAA, so we try our best. We also are putting out these numbers 7 days a week. We actually do like working weekends, or do have to sometimes work weekends because it's a requirement of our jobs. And so we try to keep you as updated and informed as we can. I hope that we will continue to have dialogue and conversation. And I'm just going to shut everything down. Feel free to email me, co.hayes.tx.us. I always forget that email. Eric, did you have any final parting thoughts?
Not at all. Thank you all for participating. Wash your hands, wear a mask, social distancing.
Right. Thank you, everybody. And we'll get the report out here in probably 2 or 2.5 hours. All right. Take care.